A lot of problems in the body come down to balance. And when it comes to fluid and electrolytes, even small imbalances can lead to noticeable symptoms. At a basic level, this system is about two things: how much fluid is in the body and how key electrolytes help regulate that balance. When either one is off, symptoms start to show up pretty quickly. First, we're going to talk about fluid itself. The body is constantly balancing when it comes to what goes in and what goes out. You can think of fluid like volume in a system. Too little and there isn't enough to circulate properly. Too much and it starts spilling into places it shouldn't be. When that balance is disrupted, you usually see one of two problems. The first one being dehydration. This is when there's too little fluid in the body. You'll start to see things like dry mucous membranes, low blood pressure, and an increased heart rate. What's happening here is simple. There isn't enough circulating fluid, so blood pressure drops. To compensate, the heart speeds up to keep blood moving through the body. Next, we're going to talk about fluid overload. On the other side, you have too much fluid. This shows up as swelling and shortness of breath. Instead of staying in the bloodstream, excess fluid starts leaking into tissues, and when it reaches the lungs, it fills spaces where air should be, which makes oxygen exchange more difficult. Next, we're going to talk about sodium. Sodium plays a major role factor in fluid balance. Normal sodium is roughly 135 to 145. A simple way to think about it is sodium follows water and water follows sodium. So wherever sodium goes, water tends to move with it. Low sodium is defined as hyponatremia. With low sodium, you'll often see confusion and headaches. This happens because water shifts into cells, including brain cells, causing them to swell. High sodium, called hypernatremia, with sodium high, you'll see thirst and signs of dehydration. Now water is being pulled out of the cells, which leaves them dehydrated. Next, we're going to talk about potassium. Potassium is critical for both muscle and heart function. Normal potassium is about 3.5 to 5.0. This is one of the most tested electrolytes, and for good reason. Low potassium hypokalemia can lead to muscle weakness and abnormal heart rhythms. That's because potassium is essential for normal electrical activity in both muscles and the heart. High potassium, called hyperkalemia, is even more dangerous. It can cause serious changes in heart rhythm since too much potassium disrupts the heart's electrical signaling. Bringing this all together, when you zoom out, each piece has a role. Fluid balance controls overall volume, sodium controls where water moves, and potassium directly affects the heart. Different roles, but they are all connected. Here's a few patterns to look at that are very high yield for your exams. Too little fluid leads to dehydration. Too much fluid is overload. Sodium causes fluid shifts, and potassium is responsible for heart function. And when you step back, this system is all about balance. The body is constantly adjusting to stay in balance. When that balance is off, symptoms show up. And the same idea applies beyond just the physical. For the desires of the flesh are against the spirit, and the desires of the spirit are against the flesh. Now we're not just looking at how the body is functioning, but where your life is actually grounded. If you're interested in that side of things, I've made some videos on it as well.